All right, joining us now via Zoom from Birmingham, UK, is a general practitioner, Dr. Esien Ukorebi. Good to have you join us, Dr. Ukorebi.
Thank you very much.
So I know that according to the WHO investigation into this particular outbreak on board the cruise ship is still ongoing. But what does the sequence of cases that we know so far tell us about how the outbreak may have developed?
Right. Yeah, you're currently correct. There's still lots of investigation going on at the moment about these virus, but the sequence is one of the key reasons why investigators, suspect that there might be interpersonal transmission that might have occurred. Initial reports suggest that one or more persons would have likely been infected earlier before boarding the cruise ship. And we know that the cruise started from Argentina in South America. And the idea is that somebody probably would have contracted this before subsequently going onto the cruise ship, where you have lots of close contact with persons, and that's how it has spread. But scientifically, we know that the hantavirus is transmitted from rodents, so rats, mice, and essentially their droppings, so their saliva, their urine, their feces. And these droppings, when they get into the air or into aerosols, they can be inhaled, and then that moves to humans, and that's how humans get it. But also, when humans stay very closely together, especially in some strains, it can be transmitted from person to person. But again, this is a very rare virus.
Absolutely, very rare. And that's why, because when you mentioned that, look, the sequencing does look like, or the sequence does look like is a human-to-human transmission. I'm wondering how, for a rare virus, how concerning that should be for everyone, especially because someone has also been identified to have taken a flight, with this hantavirus to Johannesburg, South Africa. What is the alert level at this moment?
Well, I would say that at this stage, like you rightly said when you started, the overall health risk to the general population is very low. Majority of the strains of hantavirus do not transmit from human to human, and even the recognized and the strain which transmits from human to human has a very low risk of transmitting from human to human. So I know that it's been discovered recently in South Africa that the strain implicated transmits from human to human, but this is still very low. As a matter of fact, the average person is far more likely to come in contact with respiratory viruses, flu, and other viruses than the hantavirus. So at the moment, I would say, according to WHO, the risk is very low. And then we shouldn't be overly concerned about it.
And I want to, all right, so, well, I'm sure people will be concerned. Dr. Ukorebi, you know that we're just coming off the coronavirus scare. It was a whole lot for people to deal with, and to hear of another virus, people really just get jumpy, and it's quite traumatic. But I wanted to ask about this particular virus. It's been identified as the Andes variant. What more can you tell us about that?
Well, what makes the Andes variant or the Andes strain particularly important is that it's the only hantavirus where limited human-to-human transmission has been documented. But even so, it's important to keep this in perspective. Human transmission with this virus is still very uncommon and usually would require prolonged close contact. And that's why, in a place like a cruise ship where people have been together for almost a month, it is not unusual that this can then spread from person to person. But, comparing it to the general public, I think, as I said, the risk is low. This is not a virus that spreads, with the efficiency that we saw with things like COVID-19 or even, influenzas that we have. And, authorities have said that, these risks for human-to-human transmission is very low. So again, another important point is that, antivirus can, initially look like the flu, with fever, fatigue, before progressing into severe respiratory diseases. So this makes recognition very early, and I think when you come in close contact with people suspected of this, then you should have a high degree of suspicion. But generally, it's low, and it's not one that we should be concerned about at the moment.
And I have about 2 more questions for you. I hope we have enough time to take it within the time I have left, because you mentioned the flu-like symptoms, which a lot of other diseases present. For example, malaria has that. The typhoid has that if you live in Nigeria. We also know that coronavirus also has that. And a couple of, I think it's the dengue fever as well that also has that. So, I mean, what should people do now when they start to present, whatever country you live in, start to present? I know it has not spread, but in terms of, off the rack medication, and when you have this flu-like symptoms, what should people be doing?
I think as healthcare professionals, we've always pushed for, seeking intervention, health intervention early. And so if you realize that you come down with, a flu, fever, fatigue, muscle pain, whether it's dengue fever, coronavirus, hantavirus, it doesn't really matter. When you feel unwell, as opposed to resorting to, trying to treat yourself, especially if you've deviated from your usual, state of health, you should be seeking, professional help. You should be seeking medical help. So again, this is another virus, but I think it's another reminder to the general public that if you develop unusual symptoms, speak to your doctor.
And once you have the flu, do not assume it's just flu. Go to the hospital and not self-treat. I guess that's also part of what you were saying. But Dr. Ukorebi, I also wanted to find out, because we understand that the hantavirus has no cure. So what does treatment look like? And what is the rate of fatality as well?
So again, you're right. The hantavirus at the moment, there's no specific antivirus, that can cure it. And we saw this again when, COVID-19 started. There was no particular vaccine or cure. At the moment, the focus of treatment is supportive care. So people have, fluids, they have oxygen. If they've got respiratory symptoms, they have analgesia. If they've got pain, and, their vital signs are monitored closely. And this is basically what we can do. With most viral infection, they tend to run their course, and with good, best supportive care, once the course of that virus runs through, the patient should start recovering again.
At what point, and hopefully we don't get to that point, because this ship has now docked in Netherlands. Again, I mentioned the South Africa angle to this. At what point should countries begin to think of maybe airport transport alerts, just to ensure that people are being tested, when they come in?
To answer your last question, the mortality, for the severe strain is about 30 to 40%. But again, generally, the risk of transmission from human to human is extremely low. So for countries to start implementing, travel restrictions or checking people at borders before they get in, I don't think it would be very useful, for a virus like this, where person-to-person transmission is incredibly low. So I don't think we're at that point yet, and I don't think it's useful for the hantavirus.
One part of this conversation I've really loved, as we've been having it, is the fact that you keep repeating that the human-to-human transmission is very low, just so that people don't start to panic. And I like that you keep mentioning that it is not something to worry about. It is everybody go about your business. But if you have flu, like you mentioned, I'm just trying to recap what you've said. Go to the hospital for proper check instead of getting off the rack medication. Thank you so much for your time. I'm sure that we would speak to you as this progresses. We're following the situation in Netherlands as well. Thank you for your time, General Practitioner Dr. Ukorebi. It's been a pleasure speaking with you.
Thank you so much. Thank you.